Good morning. I'm Dr. Siddharth Singh. I'm a gastroenterologist at Mayo Clinic and I specialize in the treatment of patients with inflammatory bowel diseases. Today, I'll be talking to you about a recent article on the risk of melanoma in patients with inflammatory bowel disease that we participated in. In this study, we pooled results from 12 different studies and accumulated over 170,000 patients with inflammatory bowel disease. We observed that in these patients, the risk of melanoma, which is a type of skin cancer, is about 37% higher than the average population. Melanoma is a kind of skin cancer which is the fifth most common cancer in men in the United States. Every year, close to 76,000 patients are diagnosed with it and 9,000 patients die from it. Hence, it is very important to recognize conditions which increase the risk of melanoma, and we found that inflammatory bowel disease is one of them. What do these findings mean for the patient? For a patient with inflammatory bowel disease, it means that we have to be careful about doing an annual skin exam. Melanoma appears as dark spots on the skin. It would be highly recommended that you discuss this with your physician about performing an annual skin exam. Additionally, measures to avoid sun are helpful in preventing melanomas. This would include wearing a full-sleeve shirt, a hat, and sunglasses, especially when you go out in the bright sun. Additionally, using a sunscreen with a sun protective factor of more than 30 is recommended. We would also recommend avoiding tanning beds. At this point, it is unclear how inflammatory bowel disease modifies the risk of melanoma. It is possible that due to the underlying immune dysfunction, the body is not able to pick up melanoma at an early stage and fight against it. There is a concern that medications which we use to treat inflammatory bowel disease may also increase the risk of melanoma. However, in our study, we did not observe this association. It may be too early to conclude whether medications modify the risk of melanoma in patients with inflammatory bowel disease.